A Lee County mother diagnosed with terminal brain cancer is fighting for her life after she says her health insurance company refuses to pay for her chemotherapy. She says on the 1st of this year, her insurance suddenly stopped paying for her life-saving drugs, and she doesn't know why. Four News Corner's Mike Mason looking for answers tonight.
It doesn't seem fair. Your insurance company pays for the one drug that can save your life, but then one day you find out they're not covering it anymore. That's the cruel reality for one Pine Island woman.
So who are you talking to with Medicare?
33-year-old Dawn Beagles remembers the day she was told she had terminal brain cancer in 2003.
Told to report to the hospital. So.
What did they tell you?
They told me I was going to stay.
After a year of surgery and chemotherapy, Dawn was told the cancer was gone. But last September, it came back.
Then, of course, I panicked and freaked out.
Dawn had another surgery last October, and specialists told her she would have to take a regimen of drugs each month. Dawn takes 13 medications each day, but the one that can save her life is a chemo drug called Temidor. Without it, she could die. Luckily, Dawn has insurance with Medicare and United Healthcare and only had to make a $30 copayment for that medication. But on January 1st, that copayment jumped to $660 per month.
Half of her income goes out to pay drug fees, and what's left is what she has to live off of.
What's her income? How much is it?
$11.82 at this point.
Now Dawn simply can't afford to buy the one drug keeping her alive. So why did United Healthcare stop paying for Temidor? We searched the internet and found dozens of people in similar situations. They say their insurance companies claim the drug has been reformulated, and that's why companies have raised their deductibles. Patients who paid as little as $25 now forced to pay more than $800 per month. But Dawn continues to fight. She has one very good reason to, her 7-year-old son, Christopher. She says without her family support, she doesn't know how she'd be able to go on.
It's hard enough being sick, but when you're having to basically fight to get a life-saving drug, it's all that much more difficult.
We reached out to United Healthcare to find out why they no longer pay for Temidor, especially since they did pay for it last year. We'll, of course, keep you posted on what we find out. In the studio, Mike Mason, Fox 4 News Corner.
All right, thank you, Mike. Have you seen the price of your medications skyrocket? Maybe do you happen to be in a similar situation? If so, we want to hear from you. Call us at 206-FOX4 or send us an email to news@fox4now.com.